Hello and welcome to this lecture series on the lymphatic system, which is chapter 21. We are going to start with section 21.1 on lymph and lymph vessels. First, let's discuss the functions of our lymphatic system. We want to transport and house our lymphocytes, which would be your B and T cells, and also our other immune cells within areas of our lymphatic system, whether it's going to be within our primary lymphoid structures, which we'll get into in a bit, or our secondary lymphoid structures. And our job is to return the excess fluid in our body tissues to the blood to maintain blood volume. Otherwise, this fluid would stay within our interstitial tissues and we would form edema. And then we have our lymphatic system components. So you could see throughout the body, we have these lymphatic vessels and our lymphoid tissues, not issues, and the organs, which you can see a couple of them here. And our lymph is going to move through these lymphatic vessels, again, to make it back to our circulatory system. So first, let's talk about some of the characteristics of lymph. Some of the fluid is going to leave the body from our blood capillaries. So we've learned about these before. We know that typically, I'm going to go over here in our systemic capillary network. Typically we have our oxygenated blood coming through, we'll have oxygen moving out into the tissues and waste products like carbon dioxide moving into the capillary, and then it goes back through a venule into larger and larger veins until it gets back over to the heart. So as we're having this exchange, some of the fluid is leaving this capillary and entering our interstitial tissues. Now most of this is going to move back into the capillaries, but some of it is not. The percentage that does not is going to move into the lymphatic capillaries here, where we're going to now call it lymph. And lymph is made up of water, our dissolved solutes, and a small amount of protein. And sometimes we'll even have cellular debris, pathogens, and cancer cells. And we want them to enter our lymphatic system because soon we will see that there are immune cells that can fight off these pathogens or cancer cells, and we can use things like specific macrophages to eat up the cellular debris. So let's start talking about some of these components. We're going to start talking about these lymphatic capillaries since they are new to us. So these are going to be small closed-end vesicles that will absorb the intestinal fluid. So our blood capillaries, which you kind of see in the background over here, are open-ended. So we have a portion that's connected here to the arteriole and then here to the venule. Whereas if you look at the lymphatic capillaries pictured here, they start blindly. So this is a nice little close-up here, and that blind end or closed end here. And the way that they are going to be able to pull in this fluid is through these valves, which we're going to take a look at in, I believe, the next slide. So that pulls in the fluid that way. What's unique about the lymphatic capillaries is that they're absent in our avascular tissues, such as the red marrow, our spleen, and the central nervous system, and they're slightly larger than our blood capillaries, and they have no basement membrane. So let's take a closer look at the anatomy here. The walls are made up of overlapping endothelial cells. So if you remember what an endothelial cell is, it's really just a simple squamous epithelial cell, just like that. So remember how we had that layer, just simple flat cells here. And so you could see how they are layered on top of one another. And like I said, between each one, we are going to have a valve that gets created. And they're put into place through these anchoring filaments that will hold those endothelial cells nearby the other one. Way we're able to pull that fluid in, but don't lose the structure of the capillary. Now, when we discussed the digestive system, we did talk about a specific lymphatic capillary, and those were the lacteals. We find this within the villi, within the small intestines, and we knew that we would take our amino acids and monosaccharides, and they would move into the blood capillary, but it was the fatty acids that moved into this lymphatic capillary in the yellow that we call a lacteal. And here's a histology image of what that looks like. You could see that the lacteal is white because it is difficult to stain a fatty substance. So this is a fatty lymphatic fluid that we call. Now, in order to get that fluid into the lymphatic capillaries, we use the hydrostatic pressure of the interstitial fluid, and it essentially pushes its way into those flap valve-like areas. And the pressure of the lymph inside the vessel forces these intracellular openings that we call flaps of the capillary wall to close, so that once the lymph gets inside that capillary, it's almost trapped and it has to move in the direction of the flow that we want, back toward our veins of the heart. So our lymph is going to move through the vessels of larger and larger sized lymphatic vessels. We can see this pictured over here where the lymphatic capillary is, and it's going to move through an area that we call a afferent lymphatic vessel to make its way to the lymph node. Then it leaves through efferent lymphatic vessels, makes its way over to lymphatic trunks, which will eventually merge and become a lymphatic duct, which will then enter the venous system. So we're going to go through all of these structures step by step, and ultimately we see that that lymph, which is a fluid, is returned to our blood circulation. But before we get into those structures, let's talk about a clinical view of metastasis. And this is when we have wandering cancer cells establishing secondary tumors, meaning that we have a primary cancer that is developed in one area and it gains entry either through our lymphatic system or our circulatory system, and those cancer cells are able to travel elsewhere and create tumors. So for example, if we have a bowel cancer, this can travel over to the liver or to the lungs, or if somebody has breast cancer, it can travel over to the lungs typically. Another example is if you have testicular cancer, it can travel and cause leukemia or other neoplasms of the pelvis. Now let's move back into our lymphatic vessels. So our vessels, you may be wondering where they are. Here we have the capillaries, of course, that are located near the blood capillaries. But as we go through the body and we have larger and larger lymphatic vessels, they are going to travel near our arteries and our veins. And what's interesting is that they have similar vessel tunics as our arteries and veins. So the most internal layer is called our tunica intima. Then we have a tunica media and a tunica externa. And they have valves to prevent pooling and backflow of the lymph, which is very similar to the structure of our veins, because we know that they have valves to make sure that the blood flows back to the heart. So our lymphatic system is going to lack a pump, though, to move the lymph. So we use similar structures as our veins, like the skeletal muscles that surround the vessel and our respiratory pump, so that it can push on this vessel, forcing the fluid to move in that one direction. We can also use the arteries that are located close by our lymphatic vesicle in its pulsatile movement of that blood. So as the artery has that pulse or pressure of the blood moving through, it pushes upon our lymphatic vessel to cause the same thing to happen, for that fluid to move through. And some of these vessels are connected to lymph nodes, and our lymph nodes will help with lymph filtration. So we'll talk about that in a different section for more detail. So these lymphatic vessels, like we said, they're going to travel to a lymph node and then will travel through another lymphatic vessel until it takes it to a lymphatic trunk. So these trunks, you could see we have several throughout the body, will be an area where we can have multiple efferent lymphatic vessels unite. So for instance, here we have our lumbar trunks, as well as a intestinal trunk that are all filtering that lymph into an area known as the cisterna chyli. So you'll find this in the area of the abdomen. And then from there, we are going to have it move through a thoracic duct. So we'll take a look at that duct a little bit more in about 2 slides. The other type of trunks that we have are the subclavian trunks. So we see that feeding in right here, which really helps to drain our limbs. And then a jugular trunk, which is going to drain our head and neck. And lastly, our bronchomediastinal trunk that is going to drain our deep thoracic structures. And they all are going to come together, and depending on which side you are on, it will filter into either the right lymphatic duct or the thoracic duct. So let's take a look at them in this view. We have our right and left lumbar trunks and our right and left brachiomediastinal trunks, our right and left subclavian trunks, our right and left jugular trunks, our intestinal trunk, and we mentioned the cisterna chyli, which is kind of a sac where the fluid from the lower limbs and our abdomen can filter into. Now we mentioned all of these trunks are then going to drain into a lymphatic duct, and these are going to be the largest lymphatic vessels we have within our body. They'll bring the lymph to venous blood circulation. We'll talk about how that happens in just a moment. And we have 2 specific types of lymphatic ducts. We have the right lymphatic duct here that's located near the right clavicle, and it's going to drain what we call the right quadrant of the body, meaning it's going to drain the right side of the head and neck, the right upper limb, and the right side of the thorax. And this is going to deliver the lymph into the junction between the right subclavian and the right internal jugular veins. Whereas the rest of our lymph is going to be drained by the thoracic duct, which we are going to cover in another slide. But first, let me tell you where that junction is. So here we see all of the trunks draining into the right lymphatic duct, and you could see that duct draining into the junction where we have that right subclavian vein and the right internal jugular vein. So just to highlight some of those trunks there for you, there's my right lymphatic duct, and we see it at the junction there. And then here we see the left side. So all of the left trunks drain into the thoracic duct, and then that duct is going to drain into the junction. Actually, I should have had that green line continue on over here. That junction between the left subclavian vein and the left internal jugular vein. And just another illustration here. So here we could see where that right lymphatic duct is draining into the junction of the right subclavian vein and the right internal jugular vein. Whereas here, that thoracic duct is moving up and around and is draining into the junction of your left jugular vein, left internal jugular vein, and your left subclavian vein. Just some highlights here. And here's a bit more about that thoracic duct. So this is our largest lymphatic vessel. It's running from the area of the diaphragm to the junction of the left subclavian and left internal jugular veins. And like we said, we had that sac-like structure, the cisterna chyli, at the base. And it's receiving that lipid-rich chyle from the GI tract. So I'm going to switch to this image really quick. Remember, we had our lumbar trunks coming in, but we also had this intestinal trunk that really is draining those lacteals. So all of that lipid-like lymph is moving into the cisterna chyli here. The thoracic duct is moving all the way up and around to meet at the junction of those veins. And just to be complete here, that thoracic duct is draining the lower limbs, pelvis, abdomen, left upper limb, left thorax, and the left head and neck. And as our last clinical view for this section, we have lymphedema. And this is when we start to accumulate that fluid within our interstitial tissues due to some type of interference or issue with our lymphatic drainage. So we see that swelling will take place, and you could see in this limb here how it is just growing in size. And of course, pain is going to take place as well as that swelling pinches on nerves. It can also interfere with wound healing and contribute to infection. And most of these blockages are because of some type of stoppage of the lymph flowing through these lymphatic vessels. Maybe there was some type of trauma or infection taking place, or even a tumor developing. Another example of how this would take place is in someone that is going through radiation therapy. They may develop some type of scarring, or if they had surgical removal of the lymph nodes, it kind of creates scar tissue that stops the flow of the lymph through the lymphatic vessels. So this is controlled through compression garments, exercise, and massage. And sometimes in extreme cases, this is known as elephantiasis, which is caused from an infection of parasitic worms.